So now we start with our first session of the regional meeting, and that's the on advocacy. So that's one of the main priority areas from last year's survey that our patient organizations wanted our assistance in learning to understand what advocacy was and how can they do advocacy better in the world region. So we have been organizing other events as well, but we thought this is something that we must have a complete session on advocacy. So what we are going to do in this session is kind of a workshop sort of a thing, and so we will be talking about the fundamentals of advocacy first, and it's not going to be a kind of a lecture sort of a thing, but it should be more like a interaction between us, because we are all experienced patient advocates. We have been working on patient issues for a very decades even. So what I want is to be a more interactive sessions where you can come up with examples of different things, and so first of all we'll talk about the fundamentals of advocacy. Then we will talk about communication, because communication is key, plays key role in your advocacy efforts. And after that we will have a working sort of a session. So each one of you, we will provide you with a template, very simple template, but will work and come up with an advocacy plan of your organization. So it will be kind of an individual work that you will be doing for your own organization. So sitting, reflecting, how can we do advocacy? So you can just design a campaign or whatever for the next at least 1 year period. So what's going to happen is that once we have everybody has worked on that, then if we have time, then we can present that as well. If you don't have time, then what the WPA office will be following up with them, asking them, that this is something that you decided, we hope that you are started working on that. And then, if there's any sort of support that's required from us to assist you better in your plan, please do that. So I hope you understand. So we will be at the end of the session, 1.5 hours, we will be developing our own plans, advocacy plans, a very simple format, but very effective as well. So what is advocacy? So Rehan, can you please take up the mic? What is advocacy? Can anybody tell me? What do you think? What is advocacy? So my apologies to the people online, virtually, that you might not be able to speak, use your mics, but you can, give comments in the chat sessions or even ask questions for that. And the sort of format that we are providing here, and for in-person participants, you will get, the online version, and you should be able to do it simultaneously wherever you are sitting at the moment. So what is advocacy? What do you think? So sorry?
Or people know what they are doing.
All right. So let people know what you're doing, right? Okay. Makia?
Group or individuals have an issue with voice.
Yeah. So raise your voice here.
So advocacy, like raising awareness on a matter and the cause that you feel very strongly about, but making it everyone else's problem as well. So
right. Yeah. Good. Okay. So they just love one more. Admin. Yeah.
Thank you. To me, advocacy is standing up for your own rights by not violating other people's rights.
Right. Okay. Yeah. Good one. So let's check the definition of there might be different definitions, but one of the definitions basically say advocacy is speaking, acting, writing on behalf of disadvantaged persons or group, that could be you as well, to promote, protect, and defend their welfare. So that's the definition. So basically, you're speaking on behalf of others or yourself to protect, defend your and their welfare. So, so it's basically, a very crucial part of whatever we as patient organizations do all over the world. And this basically, help us because it plays a critical role in shaping the healthcare system that's around us, the policies that are around us, the laws that are around us. Your advocacy will, and that's the ultimate goal of your advocacy, to make changes in those systems that are currently being working at all over the world. But I think we need to understand one thing. It's not one pill that really resolves the problem for everybody. So every country, every region, even every locality have different mechanism, different culture and values. So we can learn from each other's advocacy efforts, but we cannot just pick up one and implement it at other places. So, for example, like in Japan, high context culture, those things might not work in the US, and vice versa. So I think we need to learn from each other, but it has to be developed and implemented according to our own current situations. So what does advocacy do? How does it helps? And so we've already heard somebody, it really helps in amplifying patient wants and concerns to the policymakers, to the healthcare providers who are there, to the other stakeholders, and then it guides, and it helps in towards the change in policies. So policies that we really want to change, until and unless you do not raise your voice, everybody would think, everything is fine, there's no problem, everybody's happy. So you need to raise voice for the change in policies and laws. It also helps in awareness. So awareness is maybe a component of advocacy. So when you are working on your advocacy efforts, you're also raising awareness for your cause as well. It also helps in resource allocations. We are always asking, governments to, allocate more resources for our, organizations. For example, I work for dementia, so I've been advocating for for the development of daycare centers, for funding for daycare centers. So that's something that you also work for. Research support. Research is also most of the times neglected all over the world, and patients also raise voice, for research, and that not only helps in understanding of what's going on, it also helps in the development of new products, new medicines. So research, plays a very important part. It also helps in the provision of quality of healthcare in many places where patients feel the the healthcare that's provided is not of good quality or safe. We also raise voice for that as well. We also ask for patients' rights. I think if you look back about 30 years back, and now, we have lots of patient rights that have been given to patients, and that's because patients have really advocated for this cause. Nobody gives you your rights unless you make a noise. So that's really something very important. It has also helped in many places in the provision of access to treatment and services. So we are always, I think most of the time, our organizations are advocating for better access to our services. And also not only treatment, but also other support services that are required for the patients. And that also helps in the networking and community, mobilization and community networking. When you work, when you make partnerships, that really helps and gel the community together as well. And then it's a way of influencing healthcare providers all over the world. This is what we want. This is how we want our healthcare to be, provided to us. So that also does that. And obviously, all of this naturally empowers patients, and give them that power that they can speak up for their rights. So we all agree. Anything that I missed, you think? Anything that needs to be added to this list? No. Okay. I hope there's no jet lag. Some little bit, right? Yes, some. Okay, so what does advocacy require of you? So we are a patient advocate. So what does it require? I think the most important, the first thing that you need to have as an advocate is the depth of feeling. If you do not have feeling for that cause, you will not be able to advocate for your cause. So you have to be very passionate, for the cause that you're advocating for. You also need to take a lead, and make a sense of urgency. So if I'm an advocate and I'm very casual about it, and if you meet a minister and you don't just and the minister doesn't feel that energy coming out of you and that urgency, nobody is going to listen to you. So that urgency needs to be there. That why is your that topic or your issue so important, and you're asking for more than what's happening. So you're not happy with the status quo. You want more. You want a change in what's happening, and that should also be reflected in your advocacy efforts. And then you're obviously challenging and motivating the community. I've already told you, you have to convince the community. You have to tell them why is what you're asking for is important, so that they also get a part of your campaign. And it's also very important that there should be selflessness and humility, and no other motive. If you have any other interest, then then the cause that you're advocating for, I think you will ultimately may be able to not benefit the cause, but maybe some damage in some time. Sometimes people have ulterior, vested motives as well, and then in those sort of conditions, sometimes your advocacy efforts backfire as well. And instead of raising an issue once, it will require you to repeat. So this is very important. So it's not just you went and you just spoke about some issue once. It has to be consistent. It has to be repetitive. You have to keep on doing. And I'll let know one of the examples from Alzheimer's, where I have worked all of my life, that what consistency actually means and how does it actually pay off in the end. And you need to stay focused. You just can't be concentrating on one thing and then on other thing and then another thing. You just can't send mixed messages to your audience. So how do we do it? Normally, the patient organizations are not very, in at least some parts of the world, they are not very professional in terms of their management of their organization. Some are very good, but some are not very good. So I think we need to have a strategy for advocacy. So it's not something that it just came to my mind. All right, I'll go to the minister and I talked about this. But that's not an advocacy, campaign. You need to design it. You need to do, first of all, sit down and discuss, have a SWOT analysis done. Do you know what SWOT analysis is? Yeah. So you need to sit down. I'm sorry, I can't move. So you need to sit down and see what, as an organization, your strengths are. You have to list them down. What are your weaknesses? Where you lack? And what are the opportunities that are out there? In there are any partners, there are any collaborators. What sort of opportunities are there? And strengths, weaknesses, and threats. If there are any competing interests or other interests that might harm you. So you have to have put down all these lists and then make a plan, keeping how can you maximize your strength, how can you, work towards reducing your threats, how can you get benefit out of your, your collaborators and everything, opportunities. So we need to sit down and professionally and work around that. And I think it's also very important that whatever demand you have, it should be realistic as well. So we just don't talk about, going to Mars or something like that. It has to be practical. It has to be, something that's if you're asking somebody, they should be able in a position to give that as well if they agree with you. And you also, all have to provide some solutions. So sometimes when you go and meet a minister or the secretary health or whoever, and you present a problem but no solution, sometimes they also don't have any solution. So I remember once I went and met one of the secretaries about Alzheimer's disease, and I talked about, that this is a big problem, and he said, all right, that's a problem, but we have other problems there as well, and I don't know, is there a treatment for Alzheimer's? I said no. So then what do you want me to do? And I had not thought about it, that what is the alternative? The treatment is just one part, but this is what most people ask for. So what are the other things that are required of? So I had to come back. I had to redesign my campaign and then go back. So you need to have, solutions there as well, which you can present to these people as well. So we need to understand and do research. As I told you, sit down, do SWOT analysis, and understand the ground situation. What's on the ground? What do we want? What's the current problem? And that is there. What are the current laws and policies that are there? And which are the key stakeholders that are there? I think this data is extremely, extremely important. You need to understand what's going on ground and what are the key stakeholders that are there. Then ask. What do you mean by ask? Have you heard this word ask? Anybody? Now, ask means what is you asking for? What is your demand? So you have to have, as I already said, very clear demand. It can't be ambiguous, very generalized thing. If you ask for a generalized thing, you are not going to get it, because, then they would not know, what exactly and how to deliver. So you need to have, no ambiguity, but then clear objectives. You need to be very clear. And then the messages that you develop should be developed according to those objectives that you have already set, and messages should also be very, very clear. There should be no ambiguity. Facts, as I told you, you also need to have data. You also need to have facts in your hand. When you go and you meet some policy makers, you can just don't go and just show your passion. I think that's not enough. They need to understand how big is the problem, and you need to have, also, facts that are reliable, So you need to, for example, if you have facts about your condition, your disease available with the World Health Organization, I think they are the best ones, because then all the health ministries and the governments, they accept those facts. So it's very important that, those facts you have collected. Another thing that I've written here is, do not be frightened by policies and policymakers. You are the expert. The strength that you have, they don't have it, because you understand what happens during a condition, what happens to the patient, what happens to the caregivers, how is the life with this thing, and if the services, the policies that are provided, are they working or not? So they don't have an idea until unless you go and tell them, this is not right, this is not good, this is not what patients want, this is what we want. So patient advocates need to have that confidence in them, that when they go, they have the conviction that they tell them, this is what we need. And as I told you earlier, you need to have the facts, data also available with them. Pictures, graphics, may, worth 1,000 words. So look at this picture, this 90 years old person with dementia, and this 6 months old baby. Look at their faces, look at the happiness. And we use this picture for our own advocacy campaign, because when we used to go to the ministries and everybody, and they thought, oh well, these people have nothing left in them. They are just gone. So we just can't do much about it. But this picture showed that there's much more to a person. It's just dementia. So there's still so many things. There's still in that person that if we can provide better care to these people, that can improve the quality of life that these people have. So this picture really helped us a lot in our own advocacy campaign. And by the way, the people in this picture, this is my grandfather and that's my son. But we use this picture very much. So now the question, where will you start in your advocacy? So we need to have understanding what data on the issue do you know about your country. So I think, so where you start, you've done your homework, what's the current situation, what data is available with you, what else is now needed to persuade the policymakers, what else do you require? So you need to have an understanding of how can you present your case. You have to, then discuss that as well, and who all will help you. So for example, I work a lot on patient safety. So, these are the numbers, figures that I've got it from the World Health Organization. 134 million adverse events occur every year in hospital in just lower and middle income countries, and contribute to 2.6 million deaths annually. So, that shows the sort of power of number that are there, and that's acceptable by all nations and the World Health Organization as well. So, as I said, scan the environment and identify supporters. So who can be your supporters? I think this is very important that you need to understand who can be your supporters in your campaign. They can be patients themselves, they can be families themselves, they can be healthcare providers who are out there who are sympathetic to your cause. There could be bureaucrats as well. There are so many people. If you scan the people around you, you might get links that there are so many different people. So I tell you one of my examples that when we were working on Alzheimer's disease, we came to know that one of the ministers, his mother had dementia. So then we started to find somebody who knew that minister, and we ultimately found somebody. And we convinced her and we informed her about our campaign, and she said, all right, so I will talk to the wife of the minister because she's my friend. So she talked to the wife of the minister, and wife, since she was a caregiver herself because she was looking after her mother-in-law in the house. So she said, surely, I will talk to my husband. She talked to her husband. The husband, that minister, talked to the health minister. And then we met health minister, and then health minister said, yeah, I think this is a very important issue and we must do something about it. And we got an annual grant, which was a very, very important thing for us, for annual grant for running our daycare centers. So that was a big help. But how we did manage? We managed through scanning the environment, trying to find this. So it's a personal thing, the personal relationship that you try to find out. It's not only standing outside a building and chanting slogans. You need to be very systematic and try to understand. So you also need to find spokesperson. So I might not be a good spokesperson, So we need to find spokesperson, and these spokesperson does not only mean going and speaking in a public gathering. These spokesperson can be in certain places, in maybe in a health ministry. If you find somebody's father has Alzheimer's disease, that person can become your spokesperson. Your ex-bureaucrats can become your spokesperson. Your health ministers can become your spokesperson. So there's so many people. If you just find this link, they can become your spokesperson as well. And then you also have to find your champions. People who other people know, very famous people. Try to find if they have any members, or is there any way you can convince them about your cause so they can really push your cause a lot? So for example, in Pakistan we have a very famous sportsman. We have a cricket playing country, so most of you might not know, but Waqar Yunus was the world fastest bowler, and we got told. So his wife was student of one of our um, uh, organization members. So we approached the wife, and then we approached Waqar Yunus because he was as an icon, and then he was convinced, and he's a spokesperson. So whenever we need him, he's always there. He's very passionate. He's always there. So you also need to find people who others would sit back and hear to you. All right, this is something I think we also need to find somebody in our community who others would sit and listen to. So yeah, so it's the same thing as are there any celebrities in your organization that could support your cause? How could you find about their interest, and how can you contact them? What could you ask them to do? So and the other thing I think we need to understand very clearly, we cannot do everything on our own. If anybody has this misconception, I think we should take it out of our minds. We have to have partnership. We have to collaborate with other organizations, be it other patient organizations or be it professional organizations, be it doctors, be it nurses, be it other people. You have to have sympathizers, you have to have supporters, you have to have partners. Then only you would be able to have a successful campaign. Because if you're advocating and if not the doctors are not convinced, or nurses are not convinced, or other people are not convinced, nobody is going to hear to you. So that's very important. So engage with the CN makers, leverage media and social media. I think that's also something that all of us can do, but have a professionally made social media campaign. Mobilize your base, your own patients, your own organization, your own members should be the first ones who should be mobilized, and then keep on monitoring and evaluating your campaign. It's an ongoing process. So this is not working. All right, so I should not do that, but this is working. Maybe I should focus more on this event. So that's also very important. So now choose an area and make an advocacy plan. How can you do? Just a second. Yeah. So now, as I said, sorry, what happened? Yeah. So now, Iris, can you please give the advocacy plan worksheets to everybody? So this is a very, very simple. So don't please get afraid. They're just very simple pro forma that we have. So how do we work around that? So basically, so think about an activity. What do you think should work? So write it down. So maybe, for example, different countries have different systems, and so they might be different. So maybe you think that one of your advocacy campaigns should be targeting towards the parliamentarians, the people who are sitting in the parliament. You want to make them friends. So, for example, so you can put it here that reaching out to parliamentarians. So that's maybe one thing that you think. Then in your organization, who would be responsible for this particular activity? So you think Mr. X or Miss Y should be taking up the responsibility for the parliamentarian work that you are going to do. Then comes indicator. So these are tangible things. What does it mean to be contacting or influencing parliamentarians? That's so. What will be the indicator? How would you know that you have reached them? Those parliamentarians. Maybe one of the indicators you can set is you might get two people who were convinced about your cause, maybe out of the parliament, or somebody who could come to your to your event as a parliamentarian. So that could be an event. So you just think about, what should be the indicator that when I look at it and I understand that this has been successful, this activity has been successful. So you have to find that indicator that this must be tangible, something that you can calculate, you can say yes, no to that, So that's something. Then you have to think about, would this need some budget? So, for example, you have to send letters to, for example, parliamentarians. So what would be the cost of sending letters? So that's just one thing. So you make a budget of according to the indicator that you set. What budget is required, and what's the sort of time frame is there. When do you think in the next 3 months you would be able to send the letters or approach these people? So what sort of timeline is there? And then tactics means, the actual activity. Writing letters is in, actual activity. Approaching somebody is actual. So what organizing an event is a tactic. So what, maybe it is a designing a media campaign is in tactics. So this is how we have to fill this up. It's very simple, but you need to really sit down and reflect and see and think what is most important to you. Just think about it. So what is most important for you as an advocacy campaign? So just think about it, break it down into 2-3 steps. First step, first activity, then second activity, broad activities, and then who is responsible? How would I know that this has happened? Have I been successful, unsuccessful? If I need any budget, I want it in 6 months, 1 year, 3 months, whatever, and what exact activities you want to do. So I hope I'm able to, brief you on how to fill up this form. And by the way, we are, working on our own organization, but we can work together as well. We can ask others what you are thinking. I'm thinking about this, maybe, so we have so much experience sitting in this room. We can also advise others. If you're wanting to do this, then I think this could be a good tactic. This would be a good activity for you to do. So although it's for your own organization, but please share, each other's experiences. And I'm around. I'll be working with all of you. So let's start. And Rehan, how much time do we have? No, but sorry. There's one catch. We have one more presentation on communication, but you have this. But we will run that. It's a recorded presentation. So Haris, can you please run the other presentation as well, please? And I need water.
Okay, thank you for joining us. This session is communication from beginning to results. Today, we're going to talk about 3 different parts of communication. We're going to talk about basic communication, and then communicating with your healthcare provider, as well as communicating with policymakers. We spend most of our day communicating, so it makes sense that communicating clearly and effectively can boost productivity and results. So it's very important to focus on our communication. There are some basics to communication, and we have to remember that being clear and concise is important so that you can make points on what you want to make. We want to avoid filler words like, for instance, definitely, or basically. And we want to keep to our basic terms that fit our audience's level of education. And definitely try to avoid acronyms whenever you can. Provide all the necessary information needed to be informed, as well as understand what you want them to do. And use the teach-back method so that you can confirm their understanding. Now we're going to talk a little bit about healthcare providers, advocating for yourself as well as others. First, remember, when you prepare for your visit, you are the expert of your body and what you experience. Just remember that you are the expert. So what is needed? Well, the healthcare access and quality is defined as the extent to which people have equitable, affordable, and available access to needed healthcare service. But how do we accomplish that? Well, what we need to do is communicate with our policymakers as well as those in the insurance industry. And remember that it's going to vary based on the country because there could be different healthcare options. Some talking points that you can use when talking with your healthcare provider with the policymakers or the insurance folks is to expand insurance to cover healthcare cost, extend telehealth services, especially in rural areas, have access to mobile clinics, educate the public about multiple healthcare sites, whether it's online or in person, as well as improve inclusion for all. But there can be some barriers to healthcare access, such as insufficient insurance coverage, because a lack of insurance often contributes to a lack of healthcare coverage. There can also be staffing shortages, or there can be a stigma or bias within the medical community. There can always be issues with transportation or work-related problems. And then remember, there can also be a language barrier that could prevent some communication with your healthcare access. The most important thing to remember is to believe in yourself. Keep in mind that you are the expert of your body and what you experience. Just remember that you are the expert. Communicating with your healthcare provider can be difficult for some folks. So make sure that you write down a list of all of your questions that you have before you go to your appointment. If you don't understand what's going on, ask your healthcare provider questions. It's okay to ask questions, and it's just okay to ask them to explain it to you in terms that you can understand. Don't feel bad about making them go over what it is and make it a little more simple so you can understand it. And it's also a good idea to take someone with you if you have any trouble remembering what might take place, or if you're just feeling a little nervous and you want to make sure you have someone there to help you with your information so that you can remember it once you leave the visit. It's really important to learn how to access your medical records. Quite often there's the ability to have it on your phone or on your computer, and it will make it very easy to keep track of all your results, your tests, your treatment plans, any medication, as well as see what your next appointments are. So definitely try to get that logged into your phone or on your computer. And then make sure to ask your healthcare professional what their contact information is and the best way to reach them. You may find it easy to just pick up the phone and give them a call, but that may not be the best option for them. They may prefer to have an email or for you to reach out to them in that app that we were talking about on the phone or on the computer. And always remember that nurses and pharmacists are also good sources of information. Now we're going to talk a little bit about policymakers. So with the policymakers, you want to understand the needs and requirements. You want to understand their background, their personal interests, their degree of expertise. So you want to make sure you have a little bit of research on that person before you go in there. Make sure to use simple language and explain any scientific ideas in a way that's easy to understand so that they can comprehend what you're saying. Just remember, keep it simple. You want to engage in dialogue. You want to be open and honest with the policymakers and make sure that you're open to hearing their opinions and concerns as well. And make sure that you're prepared so that you can answer any of their questions. So the basic takeaway from here is know your topic. You want to be objective, clear, and concise. Remember, they don't have a lot of time. And so they're not going to want to dive into a technical paper or read a bunch of information that you give them. You want to be really straightforward and succinct when you give them their information. Remember, every second counts, and you want to take advantage of it. You want to focus on the policy implications of your organizations, as well as the needs of your community. Be aware of the political context. Policymaking is a political process, and there's a variety of factors that make it up, whether it's the public opinion, the view of interest groups, as well as budgets. So take that all into account. And remember to use visuals and stories. Information that is presented in the form of a story or a graph can make it very easy to help tell a story. And when you have a story, that's something that they're going to remember. It's a good takeaway for them. So when you meet with your legislature, there's tips for successful experience, and we're going to go over it step by step with you now. The main points to think about: protecting access to care, payment and coverage policies, public education, professional education, diversity, needs of the people to improve healthcare, and make sure there's an action item to follow up before you leave. So we're going to go over the different steps. The first step is scheduling the appointment. That's the biggest hurdle, right? So when you call your elected official's office and you speak with a scheduler, that's the person who's setting up all the appointments for that individual that you want to meet with, ask to speak with the scheduler. Make sure you get their information, and then tell them that you're a constituent of that individual and give them a brief summary of the meeting. Don't make it super long and in-depth. Just give them a brief summary of what you want your meeting to be about, as well as everyone who's going to be with you. And then ask for the contact information of the person who you would reach out to confirm your meeting just a few days before you get there. And if for some reason you cannot get an appointment, ask the office for the information of the person who you could reach to get this information from, whether it's their email address or a physical address, so you can send something to them and request this information. The second step is to be prepared, punctual, and patient. You want to be prepared when you meet your official. You want to review your material and make sure that you don't forget any of the important points that you want to go over. Policymakers have very hectic schedules, so you want to make sure that you arrive to your meeting on time and prepared. And actually, it's probably better to get there a little bit earlier so that you have time to get yourself together before the meeting. But oftentimes, it's a hurry up and wait situation where you're all ready, you have all your questions laid out, you have all your information, and maybe something happens with the legislature's timing. They may have something that came up, or they might need to reschedule. And in this case, you can ask maybe if you could talk to someone else if it's rescheduled, or maybe give information to someone else and they could then give it to the legislature or the individual you were going to meet with. The third step is to always leave behind written materials. Having a fact sheet with your basic information is very important. It's going to list your talking points, and it's going to give them something that they can have after your meeting with them, so that they can give it to their staff, and then they can review it after you've spoken with them. You can also develop a fact sheet, which is going to give information about your organization, the population that it serves, whether it's international or national, as well as some support or contact information you have in the area. And then if you have any bills that have been introduced, that's always very valuable information to list on there as well. A fact sheet should have the following. There should be the main ask, which is the main point that you want to get across. And that should be on top of the fact sheet and bold. You want to talk about why it's important for the people that you represent. You want to explain what a positive impact it would create. You want to give some statistics if you have them about the topic. And if you had the opportunity to conduct a survey, definitely put the key points from that in there as well. And of course, don't forget to put your contact information on there. Some suggestions for presenting contact in a fact sheet. Make sure to keep it brief, because again, folks aren't going to want to read a lot. They want to keep it simple. Make sure to write an active voice, define keywords or concepts, simplify your ideas, give examples, and make sure to clarify any concepts. Having graphics on there is always really important to reinforce the information. It's a nice visual for folks to see. And if it's good to have an easy to follow steps process that you could list on there, as well as any graphics that are simple and easy to understand. The fourth step is gratitude. I find it to be the most important. Saying thank you and letting them know that you appreciate them taking the meeting with you is very important. It also gives you an opportunity to reiterate the main points that you covered and what you want to accomplish from the meeting that you had. So when you write a thank you letter, you want to make sure you let them tell them that you thank them for taking the time for the meeting, reiterate the main points that you made, talk about the details of what was agreed upon at that meeting, and then when you expect to follow up with them, thank them again, and then in your closing remarks, kind of tie it in and reiterate what you wanted as well from the meeting. So think about a time when you met with a policymaker and possibly think about what type of letter that you would want to write to them. And you could maybe mock something up that would include these points. Some tips on visiting policymakers to help you reach out to your local policymaker when you schedule an appointment. We've talked about how to make the appointment, writing the letter of request, what to do during the visit, as well as the follow-up, and to make sure to have an ask of what is it that you want to accomplish and in the time that you want to complete it. So here's your checklist that you can use for the visit. So 4 to 5 weeks before, start reviewing all your information about the topic. 3 weeks before, contact others in your area who are scheduled to take part and confirm that they're going to also be able to participate. 2 weeks before, contact the policymaker's office to confirm the meeting dates and time. And then a week before, review the materials, the fact sheet, the survey information, the handouts, everything you have to make sure that you have everything pulled together for your visit. And then the day of the meeting, bring all the information together and then relax. Remember, you're the expert on the topic. We've had a lot of reminding ourselves that we're the expert, whether it's about us or it's about our topic. We are the experts. And here's an example of the meeting evaluation form that you can use. You put down your name, the date, the other folks that are going to be present, they're going to be bringing with you. And then definitely put down who you met with and their title. This is going to help when writing that thank you letter. You want to talk about the topics that were discussed, as well as provided, there's a reaction chart provided there at the bottom. And then you can list any comments that are made by the person that you met that seemed really important or just stuck out in your mind. And then if there were any questions which you did not know how to answer that you needed to research and get back to them, write that down, because you could put that maybe in your thank you note or get back to them at a later time with that information. And then any additional comments that you had, make sure to note that there. And then the most important thing is to follow up after a meeting. There was a survey in the World Patient Alliance which they conducted on health technology assessment, and it showed that while comments from attendees are listened to, there's little or no follow-up. So your main takeaway is make sure that you follow up. Thank you so much for meeting with me today and learning about communications from basics to results. Thank you.
Yes, thank you. So in practical terms,
Okay, thank you.
Kim has really presented a whole advocacy campaign in itself. So, that was a good example of not only communication, but a complete campaign, how to do it. So now we have about half an hour left, right, Haris? We have half an hour? Yeah. So we have half an hour. So I would request if you guys could please, work independently on your own plan. So we have half an hour. I'm present here. So please let me know if you want any input. Okay. So you have to indicators are valuable things that on the basis of which you understand that so let's see what could be. Yeah. So what could be an indicator? I'm just thinking about a campaign, then I can come up with an indicator. And so if you tell me any campaign that you're thinking about, I think that it's difficult to just think about an indicator without campaign. So that's so yes.
For example, if we are developing a fact sheet, that's one of the activity. That one activity could be if you're developing a fact sheet, for example, and the indicator for that could be, information collected. Number of information collected could be one indicator. To develop a fact sheet, what are the key steps that you intend taking? The intention and to reach that goal becomes an indicator. So number of meetings held with different people would be one indicator. So your main activity is the fact sheet. So how would you reach there? So your intentions would be your indicators. So number of meetings held, number of information collected, you're doing the write-up, and you're engaging people in doing that write-up in the indicator.
Thank you very much. Anything that you are planning to do, for achieving that activity is your indicator that you can. But this is something that you've done in advance, and you go back and check out, you've done this, you've done this, you've done this. Yes.
So, for example,
You're not about managing yourself, but maybe you can sit with Mark here and the patient group that's there, maybe and then design
because after this government sector approaches than patients to.
So there are two things you can do. Either sit with Mark, and then their network, develop an advocacy plan, or maybe at your own position. There are things that you want to be done, by the government. Then you can maybe sit and think, how can you within the government do advocacy?
Because we consider ourselves responsibility. Our approaches might be different.
Yes, so I was asking essentially that I come from the Saudi Patient Safety Center, which is a governmental sector. So my point of view of the activities that will be written here is different than the point of view of a patient group or a patient representation group. So I consider, or us, we consider ourselves as policymakers, for example. So when the activities would it be under a meeting with a policymaker or outreaching to a policymaker, our activities would be around something else, maybe something to, for example, lobbying those patient organizations or patient representatives and etc. So I was just trying to brainstorm with this trajectory how would this be.
So my input would be, so you are one of the lead managers at the Saudi Patient Safety Center. You are the ones who are delivering safety, and you are one of the policy. But within your organization, there might be certain things that you want to do, and for which you might need your minister's attention or your DG's attention. So how would you advocate within your own organization in getting minister to get convinced on what to think? So you can maybe do that as well. So. Maybe, whatever, you don't have to compete with all the activities, but whatever you think is one or two activities, please.
You work in the same field.
Yeah. But continue to do, activities. What you will be providing. And very, I just remember, I told you while presenting that I'll give you an example of persistence and consistency in advocacy. So, at the Alzheimer's Disease International, that's the umbrella body of Alzheimer's associations from all over the world, we decided about 10 years back that we have to convince the World Health Organization to acknowledge that it's a problem and have a resolution on dementia at the World Health Assembly. So once you have a resolution and all the countries, say yes to that, and it's kind of mandated that they have to go back and work in the industry. So what practice we do, we decided that we have to attend all the World Health Organization meeting, and by that means the World Health Assembly at the Geneva WHO headquarters. They also have the executive board meeting twice a year of the WHO. We have to attend those, and all the regional meetings. So regional meetings, all the world is divided into regions. So, for example, we are at the moment in Emro region. So Emro region has its own office, complete system that's working in the region and working with the countries in the region. So the Emro office is in Cairo for this region. So we certainly have to attend all the regional meetings as well. So 6 meetings there, and then 3 meetings at the headquarters. So and we had the same message. So I used to attend the one in Geneva at the headquarters and one in Emro. And then there were other people who were doing the PAPO meeting. Some was Seattle and Wipro and all of it. Then we would go and we would give the same message. So I tell you how consistency actually works. So when we started our next year, and after once you were there, you just speak about your cause, and then you would meet the people who are there, the ministers and everybody. So they were hearing constantly about our messages. And I remember Dr. Margaret Chen was the lead here at that time. And it was in Cairo office, myself and Dr. Yasin, she was one of the advocates. We went and we met Margaret, and we said, Dr. Margaret, we are from Alzheimer's. This is I know, wherever I go, you guys are after me. I have heard it. You said this. Said yes, I heard it. And that was the where things changed. She said, she knew those data by heart because she was hearing it for 9th and 10th time, just 1 year. So they got convinced, we got a resolution, and we got a world, action plan on dementia as well. So my message is same message, hammer that again and again and again, and people would ultimately start listening to what we said. I've heard enough. And Yolanda wants to say something else.
I support same as Hussein. I was always in the Europe region. And in Europe region, we had a very good director at the time, Susanna Yaka. And today it was about the communication. So first time I saw so open communication between the director general in the region and, for example, patient representative member organization. It was really a very, very good aspect of the communication because we, as Hussein mentioned about his organization, we had a platform to exchange our thoughts and everything. But I will tell you, we talked today about advocacy and communication. Yeah? So, yes, it's better now. Okay. So one day I saw the application for World Health Organization, and this application made that we were invited from 6 WHO region to Geneva, and I met there Hussein. Why I am telling it? Because at that time I came back to Poland, to my country, and I was sure I can change everything. I can teach everybody wash hands in the hospital, nurses, patients, doctor, everybody. And what happens? I had a meeting with the director of health department. He gave me coffee. We ate cookies, and it was finished. Nothing changed. And then I met on the next meeting Hussein, and he told me, when you have not your organization, when you not belong to any bigger organization, you can do not very much. And I decided to establish Patient Safety Foundation in Poland. But then we were thinking how to promote hand hygiene among people. And we decided we do a trek in Pakistan to Fairy Meadow. This is a beautiful place in Nanga Parbat, and that time it was so efficient because we had a press conference, we promoted the idea, this challenge, and we had people from Pakistan, from Poland, and it was so successful that even people from Polish embassy were interested in this project. And after, it was a connection from embassy support for Alzheimer's Center in Lahore in Pakistan. So I think in this advocacy, we can start with small steps, like we change each other. So we have Australia here and Philippines, and they can share the experience. They can do a project together, or online or in praxis. And our organization, What Patient Alliance, is thinking about the exchange project, that we can share our experience, our knowledge, and then some countries can also give a good ideas, good best practices, and it could help us advocate in our country. So I think it is a first step here, and after in Cape Town, we will see what happens. Thank you.
Any one of you would like to share their advocacy campaign experience? So, Aurora, you need to come onto this because people can't hear properly on the other mic. So please come here. So just very short, and then we'll have somebody from Jordan as well, and from there as well. Just share your experience, the sort of campaigns.
I started my work on thalassemia since 1991, 32 years back. And again, as Hussein said, repeatedly hammering the government and the policy makers to provide free treatment for thalassemia patients, free blood, free screening for all these things. And this was so much effective that ultimately at one point of time, though we had a meeting with the minister, and I was the only person outside the government, all others were senior officers or you can say senior doctors. There were even top post doctors were there. And I was asking for a free medicine for thalassemia patients. So one of the senior doctors said, okay, see, these patients are not going to live longer. They are going to die within 10 to 12 years or so. There are many other things were happening before that, but I'm just to one point only. At that point of time, I said to the minister, I said, okay, yes, he's right. These patients are going to die at 10 to 12 years old at age. Why to give blood? Let them die at 2 years. At least you will be saving blood for next 10 years. And the moment I said this, the minister said just one thing, nothing doing. He asked the director of health services, whatever he wants, you give him. And immediately he sanctioned anything. Then there was we were asking for a tax waiver. So I was repeatedly asking for this tax, the sale tax, you can say, sale tax waiver for the medicine thalassemia. And there was a special meeting of around 1,000 people were there. I was a member of that sale tax committee, and I just stood up to talk something else other than thalassemia. The moment I stand up, the minister and even the secretary said, "Oh, Dr. Ullah, I know you are asking for the tax waiver. We'll do it. Just wait for that." So this happens if you do repeatedly. So that was the thing I'm saying you. They remember you once you do it repeatedly. Thank you.
Just tell us about what did you do in your advocacy campaign?
Hi everyone, how are you? I'm Hamza Nouri. I am the youngest founder and president in the world to run the first and only Alzheimer's Association in Jordan. So my journey started because of my aunt who got diagnosed at the age of 45 with frontotemporal dementia. And back then I was only at 15 years of age. So with advocacy, we work closely with governments, of course, with the WHO, of course, as the World Health Organization, but as well we work with the Ministry of Health and the Ministry of Social Development, as well as for advocacy and for policy. We are working on one of Jordan's first dementia global action plan of implementing it in Amman, and within that we are educating people on raising awareness. We are educating doctors, nurses, caregivers on how to deal with a patient with dementia. Throughout that program, we have a program called, I don't know if Dr. Hussein, you have it, it's called Dementia Friends, because we also launched the Dementia Friends program in Jordan on how to deal with an Alzheimer's patients. And hopefully soon we're still looking for phases to open the first daycare center in Amman. And within the advocacy, we have finally got a royal patronage because we are a kingdom at the end of the day. So King Abdullah's mother is our royal patronage, Her Royal Highness Princess Muna Al Hussein of Jordan. And so that's basically it. So we've been influenced by, we always speak to influencers, royal patronages, and we're working on bits and pieces. So thank you so much.
Thank you.
Two minutes. Okay. I have only 2 minutes to talk to you. I agree with the lady to say that we come here to learn each other and we share what we are doing because we know that we are all the patient organizations and we are not news, not just established. And our job is advocacy, the communication. I work with our patient organization 13 years, since 2010. And last 10 years, I do a lot of things on communications, advocacy. Now it's my job, our job. I mean, that we do the podcast every week. I just show you, can hear the little bit about the voice. Just
như là sức khỏe chung. Thì như ta thấy rằng là rượu và da nó cũng có liên hệ mật thiết. Và trên thực tế, ta nhìn thấy một người mà.
That's what we are doing, talking with doctors to share information to patients. And we do the video clip. You can see we have 1,000 people now watching our videos. And we do the live stream when we do the meeting, and we also participate to the conference if the people organize. We bring information to each other. That's our job. If you want, anybody want to share our experiences, I think that I can have a time to talk to you, maybe half days or 1 day. Thank you.
Thank you very much. Yes, our friend from China, please. Yeah.
In 2 minutes. Personally,
what's your name?
So I'm Lee from China Chronic Skin Disease Foundation, and personally, I brought my poster here. So we are working on different chronic skin diseases such as psoriasis. So people have a lot of misunderstanding about psoriasis. So is that conjunctive? Is that if I have psoriasis, it means that I cannot date with people, which means I can have normal life. So we made a movie in China. So we invited a director with psoriasis. So he, as the patient, he knows what's the need of the patient. So we made a movie to tell the public, the patients, that even though you have psoriasis, you still can have love, you still can go back to your normal life, you still can chase your dream. So yeah, that's what we are doing. So I think the movie was funded. We got it funded from Novadix, a company focused on psoriasis. So that's what we are doing. We work, and this movie is under the final, let's say the final check by the government, but it should be coming soon by the end of this year. And that's what our advocacy, that use a movie. People like to watch a movie to let the public to understand what the patient needs, and let the patient know you are good to go. You can enjoy your life. That's it. Thank you.
Thank you.
And after all, culture, if you want.
I think how much time do we left with? So I know you guys are working. So can I just ask any one of you just wanted to share? I don't want the complete thing, but what advocacy plan are you trying to make? Who are you targeting? So maybe on this table, just want to share, if what sort of plan. There's a second table. Your table, yeah. Don't look behind. Yeah. So what plan are you making? Just who are you targeting? Yeah. Okay, Dr. Shin, you can come here.
Hi, hello everybody. I try to be very brief. My name is Shin Yoshiro from Japan. I'm working in hospital. I'm a physician. I also work in a foundation in Tokyo that is running hospital accreditation. So I'm working on a physician's side or the foundation side, not on patient side. But what I'm doing, which is very unique, is the no-fault compensation system for birth injury. So birth injury often ignites lawsuits, often ignites fighting between medical professionals and families. And so we provide money and we investigate a case and publish a report to patient and families and the medical professionals. They read the report and they will know what happened during delivery, and the lawsuit declined dramatically. I happened to know that similar event is happening in Malaysia and in United Kingdom. For instance, I repeatedly published a scientific paper on this system. I repeatedly delivered a lecture on this system. And last year, I was invited by the House of Commons of the UK Parliament to describe the system. And in coming December, I'm invited by the House of Lords of the UK Parliament to describe the system. So I think I would like to contribute to addressing this issue, which is burning now in the United Kingdom, particularly in NHS England. That's my contribution, and that's my advocacy for addressing this issue. Thank you very much.
Anybody wants to say anything, the plan regarding the plan that you're making, or anybody else? Yeah, why don't you come over here? Just let us know what you're planning in this document.
Hello everyone, my name is Eugenie Lee. I'm from Australia, representing Global Alliance of Partners for Pain Advocacy. What we are trying to do within our organization is pretty much in a 3 points. One, to integrate pain patients' voice into pain research and co-design equitably within pain science with the scientists and clinicians, because from our patients' perspective, we tend to be at the bottom of the rung within the hierarchical system, and our voice is often not heard. So what we are trying to do through GAPA is to bring our voice to the forefront. As the presentation mentioned, that we are the experts, and we want to insist our expertise on an equal level. And we want to be able to disseminate the latest knowledge of pain research effectively and efficiently. So within the high-income countries, it takes average 17 years for the pain research to trickle down to the clinical levels. And God forbid how long it would take for that knowledge to translate into the low or medium income countries. And we want to speed this knowledge gap as quickly as possible. So we want to bridge this knowledge gap. And how do we go about it? We are still at this infancy. And we also want to bridge the gap between the views or perspectives between the lived experience pain and the researchers and clinicians. So often the people who are within the research or medical research field, they don't value our own expertise as patients. But we want to bridge this gap. And our views are just as important, and we want to be able to contribute it, and our views can be treated with equal considerations. So that's what this GAPA is formed, and that's what we are trying to advocate. Thank you.
All right. Good morning to everybody. My name is Edmund Lau. I'm from Singapore. So again, I've dutifully done an advocacy plan based on the instruction from our dear Hussein. So altogether, I have come up with some of the 7 activities based on these 7 roles. So I just have to highlight 1 or 2 of them very quickly. One of them is psoriasis awareness campaign. The responsibility will be done by the marketing and the communication team. The indicators will be the amount of reach, the engagement rate, as well as the changes in public awareness level on psoriasis. Because the main message we want to bring out for psoriasis patient is psoriasis is not contagious. That's one of the key messages. And of course, the budget we're looking out for is about Singapore $20,000. The time frame will be done in October, whereby this will be the Psoriasis Awareness Month. And of course, the tactics will be using social media campaign, using hashtag. We notice this is a very important hashtag communication tool. Example like hashtag understand psoriasis. And we would also like to propose to partner with the appropriate influencers. That will be in Singapore. And if we will do it in Asia Pac, so certainly we will have more mileage in that sense. When we come up with a milestone, maybe tomorrow or today. Lastly, I'll just highlight one more thing. We have a lot of problem engaging with the youth. So again, one of them is the activity will be youth and school outreach, and the responsibility will be done by the community outreach coordinators, which we are yet to assign or appoint. The indicators will be the number of schools reached, student and teacher feedback, and the number of informational packets distributed in the schools. And the budget is, I think, is pretty conservative. It's about 10,000 Singapore dollars. So the time frame is a school year period, because outside of this period, they are either traveling with their parents and so on and so forth. And finally, the tactics will be workshops and informational sessions in schools. Number 2, development of age-appropriate educational materials. And finally, interactive activities like art contests to engage with the appropriate students. With this, thank you so much for your attention.
Very impressive, excellent. And I think this is exactly how we should, be developing our plans. A very, very clear chain of thoughts and a very clear on what, is required to be done. So we are taking a break now. It's a lunch break. What I would request you is for those who have developed something or whatever, maybe, it's not complete. If you could just, give it to Rehan, give it to me, he'll just take a picture of your plan, and then he will follow up with you for you to really work on it later on once you are back in your hometown. And then, we will follow up with you regarding any progress. So that's one thing. We have a lunch break right in the same restaurant where we had our breakfast in the morning, downstairs, and we will be back. Please come back by 2:25. Okay, 2:25. We should be back for our next session. And when we come back, we'll also have taken a picture, a group picture as well. So I want all of you to be here, please, by 2:25. Thank you.